Hi, I'm Dr. Naomi Potter. Welcome to Is It Hot in Here? Today we are going to talk about a subject that is very tricky and emotive to discuss, and that is feeling suicidal or suicidal thoughts in perimenopause. Unfortunately, it's a subject that is, or it is a symptom that is not uncommon, but it's also one that is probably one of the most difficult to talk about. So a lot of women experience it and they don't ever report it to anybody, which makes it hard to identify and treat. But also it's a symptom that can be treated. So it doesn't have to be so difficult that we can't do anything about it. The thing about feelings of despair and feeling suicidal is that although they might feel overwhelming and like they're never going to get better, there is actually a lot that can be done about it. So if you are feeling like that and you're having negative thoughts, please do seek the advice of your doctor as a matter of urgency. There is help out there and it is classified as an urgent need. This is not something that you should wait 6 or 8 weeks to see somebody about. This is something that you should be able to see somebody about straight away. If your symptoms are severe, you can use out of hours services, emergency GPs, A&E, crisis lines, the Samaritans. There's all sorts of different bodies that you can access help from, and you must. It is never, feelings like this are never trivial. And then depending on who you see and how severe your symptoms are, different treatments can be started straight away. And that will very much depend on what your underlying medical conditions are. Using HRT can very much help. Using antidepressants can sometimes help, and using psychological therapies can help as well as all the usual lifestyle modifications. So there is plenty that can be done, but the most important thing is that you seek help as soon as possible. So although feeling suicidal isn't necessarily the first symptom that a woman will discuss with you, it is fairly common, and in the women that come to my clinic, because the women that come to my clinic tend to be more extreme in their symptoms. But it is something that as doctors, we are taught to ask for. So if somebody has negative mood or low mood or feelings of anxiety or negative mental health symptoms, then it is something that we safety net for. So we ask them whether they are feeling despair or whether it's not worth going on or whether they have suicidal thoughts. So it's something that we are trained to pick up on, because depending on how severe those symptoms are, sometimes it warrants, emergency treatment. So a report published by Cambridge University last year reported that 16% of perimenopausal women experienced suicidal thoughts, and up to 30% of women with an early menopause experienced suicidal thoughts. So this illustrates that it's not something that happens in rarity. This is something that that is a not uncommon symptom in perimenopause. We don't really understand exactly how hormones impact on mood, but we know that certainly estrogen and progesterone hormones impact on how our brains function normally. And so in women who have a prior history of mental health issues, the hormonal fluctuations can exacerbate them. And in women who don't, they can cause them to develop. And we don't really understand the true mechanism of how that works, but we certainly see it as a strong correlation. We know that hormones throughout a woman's reproductive life affect mood. So we see this with premenstrual syndrome, and we also see it with postnatal depression. So in women who have an earlier menopause diagnosis there's a bigger impact on their lives. So they are less likely to have completed or even started their families. There's the fertility implication, but also the kind of knock-on femininity implication, and going into menopause has significance to women. And it may be that that's the reason why women who are younger when they have a menopause are more likely to experience more severe mental health issues. It can be really hard to establish whether mental health symptoms are due to hormones or whether they are a pure mental health condition. But without a trial of hormones in a woman who you suspect it's down to hormones, is you can't know whether that's going to cure it or not. There's no specific test. Is this a hormonal mental health issue or is it a non-hormonal mental health issue? So really it's using medications and hormones according to your own clinical experience and best practice that helps. That's the pathway that we go down in order to help women. I think there are a number of obstacles to receiving care. I think firstly, the NHS is massively under pressure and just getting an appointment is really hard sometimes. So if you are feeling incredibly low and suicidal, just the effort of picking up the phone at 8 o'clock in the morning and waiting in line to be the 13th person in a queue to wait to book an appointment can be so overwhelming that you just choose not to do it. The thought of taking yourself down to A&E, which is, not always the most calm environment when you're feeling like that, can be really overwhelming. But my suggestion would be to try and find somebody close to you that can help do those things and make those pathways easier. So find a loved one or a friend or family member that can pick up the phone on your behalf, that can take you somewhere, and so that you don't have to put that mental effort in. So I think that's probably the biggest hurdle, because once you do access help, like your GP will be used to seeing situations like this. They're very well trained in dealing with mental health crises, and it's part of what they do on a day-to-day basis. So I think really it can be that first obstacle that can be the hardest. Not always, and of course everybody has different experiences, but in my experience that seems to be what the hardest thing is. And then I suppose another hard thing is that treatments don't tend to work straight away. You won't walk into your GP, be given a tablet, and by the next day feel better. It doesn't work like that. So it can take time. It can take trial and error. There can be side effects associated with medications, both HRT and non-HRT medications, that can feel like real hurdles. But as I say to so many women, like my clinic is filled with perimenopausal women who are in the absolute doldrums with their symptoms, including mental health symptoms. But it's not filled with women in their 60s and 70s or even late 50s. You do tend to come out of it feeling good. It's just that peak hormonal turbulence that seems to bring with it the most desperate symptoms. If what I've talked about today resonates with you, if you're having suicidal ideas, or you're incredibly low or anxious, then please do know that help is available, and your best port of call is your own doctor. But if things are feeling really bleak, then please do contact the Samaritans, your out of hours GP services if it's out of hours, A&E, or your GP on the day if it's a working day. We see lots of patients in clinic with this as an ongoing issue, but a menopause service isn't an emergency service, and it's really important to know that you shouldn't wait to see anybody if you're experiencing these symptoms.